Let us now go to the overview of visual diagnosis of the limbs. Visual diagnosis of the limbs includes observation of the size and quality of the muscles, whether there is edema, and observation of the skin and blood vessels, and whether there is spasms, tremors, or muscle cramps. Observation of the limbs has relevance in both acute and chronic patterns. Stomach and spleen qi is reflected in both the quality and mass of the muscles in the arms and legs. If there is stomach and spleen qi deficiency, there will be an inadequate production of qi and blood. This will mean that the muscles lack nourishment. A sign of stomach and spleen qi deficiency and blood deficiency can therefore be muscle atrophy or underdeveloped muscles. This can, of course, also be a sign of Jing deficiency, especially in children, as well as kidney and liver yin and blood deficiency in older people. Muscles that are flaccid and weak but without a loss of mass can be seen in acute conditions when heat injures Jin Ye. Chronic conditions of weak and soft muscles are seen when stomach and spleen qi deficiency results in blood and yin qi not nourishing the muscles. Kidney and liver yin deficiency can also result in muscles not receiving adequate nourishment. Dampness and phlegm can block qi and blood from nourishing the muscles. Very stiff and inflexible arms and legs usually indicate an invasion of exogenous wind in acute cases or internally generated wind in chronic cases. The arms and legs can be rigid and stiff because joints are inflexible. This inflexibility can be due to phlegm, resulting in changes and deformity of the joint. It can also be due to blood stagnation or edema on the muscles around the joint. Edema around the joint arises when there is damp B or when there is spleen and kidney yang deficiency. Liver and kidney yin deficiency can result in the joint being too dry and becoming stiff. Liver blood deficiency can mean that the tendons and sinews lack nourishment and thus become stiff. Tremors, spasms, and cramping of the muscles in the limbs will always be caused by wind. There are, though, differences in how the wind has arisen. It can be due to invasions of exogenous pathogenic qi penetrating deeper into the body and generating heat, resulting in the arousal of internal wind. This is seen, for example, when there are febrile convulsions. Internal wind can also rise when there is ascending liver yang, liver yin deficiency, and liver blood deficiency. Acute edema of the hands may occur during an invasion of wind cold that interferes with the lungs' ability to spread Jin Ye. If the edema is chronic, and especially if it is pitting, it will probably be due to kidney and or spleen yang deficiency. Edema that is not pitting is more typical of qi stagnation. Blood stagnation can manifest with small but visible purple thread veins or spider nevi. This is typically observed on the ankle area in geriatric patients. Varicose veins are a sign of spleen qi deficiency that is failing to maintain the structure of the blood vessels and or blood stagnation. For observation of the limbs and its significance, when there is muscle atrophy or underdeveloped muscles, that is stomach and spleen qi deficiency, qi and blood deficiency, and Jing deficiency. For muscle weakness or laxity, there is stomach and spleen qi deficiency, heat, damp heat, liver, and kidney yin deficiency. For rigid and inflexible arms and leg muscles, there's blood stagnation, qi stagnation, dampness, phlegm, wind, kidney and liver yin deficiency, and liver blood deficiency. For paralysis of the arms or legs, there's wind, whether internal or external, phlegm, dampness, blood stagnation, or liver and kidney yin deficiency. For tremors, spasms, and muscle cramps, that's wind that is internal and external. For edema, there's invasion of wind cold, kidney or spleen yang deficiency, or qi stagnation. For spider nevi, that's blood stagnation, and varicose veins is spleen qi deficiency and blood stagnation. Thank you so much for your attention.